الحمد لله رب العالمين، والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Maternal and Child Health Services 3, or Preventive Services for Mother and Child, by Professor Mahmoud Hani Sulaiman. Intranatal care. It means care taken during delivery. This consists of taking care of not only of mother but also the newborn at the time of childbirth. Objectives of intranatal care: to promote clean and safe delivery, to prevent infections in both mother and newborn, to recognize danger signals and be ready to manage them, to take immediate and essential care of newborn at birth, to reduce infant mortality rate and maternal mortality rate. Clean and safe delivery equal preventing or minimizing injury to mother at time of birth. Traditional birth attendant TBA or DAYA conducting delivery at home in rural areas is trained to conduct safe delivery with good perineal support without episiotomy to prevent lacerations of perineum. Episiotomy is given only in institutional deliveries. Room where delivery conducted should be clean, dust-free, and warm. Clean, dust-free, and warm. Clean delivery means conducting delivery under aseptic precautions, and safe delivery means causing minimal damage to the mother. Prevention of infections. They are also trained to conduct and clean and safe delivery by observing 5 cleans. 5 cleans: clean hands, clean surface, clean razor blade, clean ligature, clean cord stump. The 5 cleans: hands, surface, razor blade, ligature, cord stump. Observing 5 cleans helps to conduct delivery under aseptic precautions which will prevent infections like neonatal tetanus, ophthalmia neonatorum, and puerperal sepsis. Therapy: reducing infant mortality rate and maternal mortality rate. What are danger signals at time of delivery? They are either maternal or infant. Maternal signals: obstructed labor, which means good pains but no progress, obstructed labor, sluggish labor pains for more than 24 hours, bleeding during labor, convulsions, high temperature, placenta not separated even after 30 minutes of delivery, i.e. prolonged third stage of labor, collapse of the mother. Maternal danger signals: obstructed labor, sluggish labor, bleeding labor, convulsions, high temperature, not separated placenta, collapse of mother. Continued danger signals at time of delivery. For the fetal part: meconium stained liquor amnii, sudden change in fetal heart rate less than 120 or more than 160, prolapse of umbilical cord or hand. Mothers with normal obstetric history can have their delivery at home with the help of trained DAYA or health worker female. This is known as domiciliary midwifery service. So, danger signals at the fetal part: meconium stained, sudden change heart rate less than 120 or more than 160, prolapse of umbilical cord or hand. Advantage of domiciliary care. Familiar environment to mother, no chances of cross-infection, mother can supervise domestic affairs simultaneously, less mental tension. Disadvantage of domiciliary care, absence of medical and nursing supervision, mother resumes back to her duties very soon, rest is less, she may neglect her diet. Even though pregnancy and childbirth is a normal physiological process, it is associated with great pathological potential. Therefore, institutional deliveries are preferred. Advantages of institutional care. All high-risk cases can be managed, medical and nursing supervision constantly available. What are the disadvantages of institutional care? Cross-infection can occur associated with tension as child is born, immediate care is taken, discussed under services to the children. Postnatal care. This includes taking care of the mother after delivery and also the newborn. Objectives of postnatal care: to promote speedy recovery of mother physically and psychologically, to prevent development of postnatal complications, to check adequacy of breastfeeding, to provide family welfare services, to provide care of newborn, to reduce infant mortality and maternal mortality rates. So the objectives of postnatal care: to promote speedy recovery, to prevent postnatal complications, to check breastfeeding adequacy, to provide welfare services to the family, to provide newborn care, to reduce infant mortality rate and maternal mortality rate. Promotion of speedy recovery physically. This is necessary because of stress and strain mother had undergone during pregnancy and delivery, done by regular postnatal checkup and postnatal advice. Postnatal checkup, postnatal advice. Postnatal checkup. After delivery, mother examined regularly and periodically, twice daily for first 2 days and then once daily for 1 week. At each of these examinations, 7 things must be positively looked for. Those are temperature, pulse, respiration rate, blood pressure, breast, abdomen, and perineum. Temperature, pulse, respiration, blood pressure, breast, abdomen, and perineum. Increase in first 3, temperature, pulse, respiration, indicates infection, purple sepsis. Breast examined for engorgement, tenderness, position of nipple, and cracks or sore nipple. Abdomen to assess involution of uterus and tenderness. Perineum examined for nature of lochia, episiotomy, wound if any. Normally lochia is reddish during first 4 days, lochia rubra. Pale red during next 4 days. So reddish first 4 days, pale red next 4 days, lochia serosa, and whitish during last 4 days, lochia alba. Foul smelling lochia with yellowish color indicates infection of genital tract, puerperal sepsis. Postnatal advice. It is given on the following points: nutrition, rest and exercise, postnatal exercise, personal hygiene, sexual relation. the advice about nutrition, rest, exercise, personal hygiene, sexual relation. Nutrition. No restrictions in the diet except for first 2 to 3 days. Balanced diet should provide 2,500 kilocalories of energy per day. She should consume nearly 1.5 to 2 times regular food. On rest and exercise. Since she has undergone stress and strain, she must take absolute rest on first day. And from second day onwards, she must be up and move in home. Postnatal exercises after few days helps in restoration of tone of stretched abdominal and pelvic muscles. She can resume back to routine household activities gradually. See next figure. On personal hygiene, she must maintain a high standard of personal hygiene by daily bath. She must not be too much concerned to use soap to the nipple because it may predispose for sore nipple. Perineum must be also be clean. On sexual relation, she can resume preferably after 6 weeks of delivery. 6 weeks, 1.5 months. These are some exercises for the mother to do. We will begin from here on the left up, squeeze buttocks, right up, keep back straight. Here, bend one knee. Here, take knee to forehead, as you see, knee and forehead. Here, stretch leg as far as you can. Here, reach for your knees. Here, tilt pelvis, breathe normally. These are some examples of exercises in this period. Promotion of speedy recovery psychologically. This is necessary because a recently delivered mother will have anxiety, tension, and a sort of fear complex born out of ignorance. Even some of them have depression. To remove this and to build up confidence in herself, she is allowed to talk freely, frankly, freshly before health personnel to solve all her problems, confusions, and doubts about taking care of a child. Prevention of development of postnatal complications. The dreaded postnatal complications are puerperal sepsis, thrombophlebitis, and postpartum hemorrhage. Puerperal sepsis, thrombophlebitis, postpartum hemorrhage. The minor complications are mastitis, urinary infection, etc. Three major complications constitute important causes increased maternal mortality rate. Puerperal sepsis. This is infection of reproductive organs acquired after abortion or during labor or within 42 days of delivery, postpartum period. This is a serious condition as it can spread rapidly due to increased vascularization of pelvic organs at time of delivery. Clinically equal high fever, severe pain, tenderness of lower abdomen, foul-smelling yellow-colored lochia, often lead to septicemia, shock, and death. Other complications of puerperal sepsis are pelvic and general peritonitis, renal failure, coagulation failure, multiple septic emboli. Continued puerperal sepsis, usually due to lack aseptic precautions while conducting delivery and lack of perineal hygiene after delivery also occur after prolonged labor or incomplicated deliveries. The risks of infection also high if labor does not begin in 12 hours after rupture of membranes. Risks still increase if vaginal examination is done in this stage. Prolonged third stage is another cause of puerperal sepsis. All this can be prevented by 5 clean, aseptic precautions while conducting the delivery at home and maintenance of high standard of personal hygiene after delivery. Thrombophlebitis. This is infection of deeper veins of legs. Clinically, high fever, painful swelling of legs, tender legs, severe pain on movement of legs often may result in embolism. Usually, it is due to immobilization of legs following absolute bed rest after delivery. This can be prevented by encouraging early ambulation of mother on second day after delivery. Postpartum hemorrhage. Certain amount of bleeding per vagina does occur after delivery. This is usual. Hemorrhage equal if bleeding is more than 500 milli after birth. PPH is of two types, primary or secondary. Primary PPH. Primary PPH if hemorrhage occurs in 6 hours of delivery. This could be from uterus, lacerated cervix, or vagina. From uterus, it is usually due to atonia of uterus, or retained placenta if not delivered in 30 minutes after birth of child. Atonia of uterus managed by giving injection ergometrine by manual compression of uterus and blood transfusion. Laceration of cervix or vagina managed by putting stitches followed by good pack of vagina with sterile gauze piece and blood transfusion. Atonia of uterus cannot be prevented. However, administration of misoprostol, oral prostaglandin, can prevent PPH due to uterine atonia. Postpartum hemorrhage continued. Secondary postpartum hemorrhage equal if hemorrhage after 6 hours of delivery, between 5th to 10th days, usually due to retention of bits of placenta and often followed by puerperal sepsis. It is managed by exploration and evacuation of uterus under general anesthesia. This can be prevented by secondary postpartum hemorrhage can be prevented by careful, correct, and complete removal of placenta. Minor complications like mastitis can be prevented by expression of milk as soon as there is breast engorgement, and urinary infection can be prevented by personal hygiene of perineum. To check adequacy of breastfeeding, this is necessary because most of our mothers think whenever a child cries that she is not secreting sufficient milk for the baby, and very soon she will start external feeds. So, adequacy of breastfeeding can be checked by asking mother how many times the child is passing urine per day. Times the child passing urine per day. If the child is on exclusive breastfeeding and passes urine about 8 times per day, that means mother is secreting adequate amount of milk. 8 times per day of urine from the infant means the mother is secreting enough milk. To provide family welfare services, if it is first delivery and mother wants a second child, she must be motivated for spacing by IUD method so that she can have a gap for at least 3 years. Birth spacing. It is a health measure. The risk of maternal complications and perinatal deaths increase if pregnancies are frequent and closely spaced because of depletion of maternal reserve of iron, calcium, and other essential micronutrients. Iron, calcium, and other essential micronutrients. So, birth spacing prevents maternal depletion, promotes general health of mother, promotes health of child, reduces maternal morbidity and mortality, reduces incidence of low birth weight, reduces perinatal and infant deaths. To provide care of the newborn, the mother is informed about the following: scientific practice of breastfeeding, periodical immunization, growth monitoring, and breastfeeding will be discussed. Immunization was discussed before. Growth monitoring will be discussed in details. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.